Hello, everyone, and welcome. It is great to have you here today. Grab a cup of tea, get comfortable, and let us dive into today's topic. Today, we are looking at how we manage an irregular heartbeat. First, we need to understand a technical term you will hear a lot, which is arrhythmia. An arrhythmia is simply a heartbeat that is irregular. Think of the heart as a very dedicated drummer in a band. Usually, it keeps a perfect, steady beat. But sometimes, it loses the rhythm. It might beat too fast, too slow, or just irregularly. That is an arrhythmia. To manage an arrhythmia properly, we need a very precise diagnosis of the exact type of irregular heartbeat we are dealing with. How do we do that? We use something called electrocardiography. You might know it simply as an ECG. This is a test that records the electrical signals in the heart. It is like plugging the drummer's microphone into a soundboard to see exactly where the beat is dropping. An ECG is absolutely essential for making a correct diagnosis. We also have to look at the big picture. Why is the heart losing its rhythm? Sometimes there is an underlying cause, such as heart failure. Now, heart failure does not mean the heart has completely stopped. It just means the heart is not pumping blood around the body as effectively as it should be. If an underlying cause like heart failure is present, we must give that the appropriate treatment. You cannot just fix the drum set if the drummer is exhausted. So, to summarize our first point, if the heart loses its rhythm, we use an ECG to find out exactly what type of arrhythmia we are dealing with, and we make sure to treat any root causes like heart failure. Now, let us talk about a specific little hiccup called ectopic beats. The word ectopic literally means out of place. So, an ectopic beat is an extra heartbeat that happens out of its normal sequence. Imagine our drummer accidentally hitting the snare drum an extra time in the middle of a song. For the patient, it often feels like a skipped beat or a sudden flutter in the chest. If these ectopic beats happen spontaneously and the patient has a completely normal, healthy heart, we rarely need to give them any medicine. Usually, the best treatment is just reassurance. Simply sitting them down, explaining what is happening, and letting them know that their heart is fine will often suffice. Sometimes, peace of mind is the best prescription. However, sometimes these extra beats are particularly troublesome for the patient. They might happen often and cause a lot of anxiety or physical discomfort. In these cases, a type of medicine called beta blockers are sometimes effective. Beta blockers work by blocking the effect of adrenaline on the heart, essentially telling our over-enthusiastic drummer to just chill out and stick to the sheet music. If we do need to use medication for troublesome ectopic beats, beta blockers may be safer than other types of drugs used to suppress irregular heartbeats. We always want to choose the safest option that gets the job done. Let us quickly recap that last part. Ectopic beats are extra out-of-place heartbeats. If the heart is otherwise normal, just reassure the patient. If the beats are really bothering them, beta blockers are a safe and effective way to calm things down. And that brings us to the end of today's lesson. Thank you so much for listening, take care of yourselves, and I will catch up with you in the next session. This video was brought to you by Pharmacy Skills. If you enjoyed this video and want to see more like it, Pharmacy Skills offers a comprehensive animated learning library covering the BNF, MEP, and general pharmacy training. Each video also includes practice questions and a range of revision tools to help support your learning. Visit us at www.pharmacyskills.com.